Good evening, folks. You're all very welcome to this special webinar session with DCU Postgraduate Studies. I'm Martin Kelly from the DCU Postgraduate Student Recruitment Office. And this evening, we're bringing you a host of webinars across our Faculty of Science and Health, and in particular across our schools of nursing. As well as that, we'll be mentioning topics such as child and family health and wellbeing. We'll be introducing to some of our programs that focus on health and social inclusion as well. And with that, I'm not going to be doing it by myself. I've got some fantastic company and help this evening. So how the webinar is going to work, we're starting off with a talk looking at our MSc in Specialist Nursing, and we're looking at the two specialisms there. That'll be presented by Programme Chair Mary Nevin. Following which, we're going to have a presentation on the MSc in Child and Family Health and Wellbeing by Carol Barron. And then in conclusion, we're going to have Dr. David Lockery from the programme of the MSc in Health and Social Inclusion. So folks, how this is going to work, our programme chairs are going to present on their courses. If you have a question, please type it into the chat, and once the presentation has finished, I'll then pose the question to our programme chair and they'll be able to give the answer. If for whatever reason you don't feel like putting it into the chat, obviously there will be contact information supplied to you all, and there will be a recording of this webinar sent to everybody and made publicly available as well. But without further ado, I'm going to stop talking and let the people you want to hear from have their moment to speak. So I'm going to introduce now Mary Nevin from the MSc in Specialist Nursing. Mary, I'd like to hand it over to yourself.
Thank you very much, Martin. I'm just going to share my screen here for everybody so that you can see what I'm looking at. Okay, can everybody see that okay? Okay, thanks, Martin. Well, first of all, thank you all for joining this evening's session. And if you're here live, my name is Dr. Mary Nevin, and I'm the Programme Chair of the Masters and Graduate Diploma in Specialist Nursing. So I'm going to spend the next 10 minutes or so, 12 minutes, taking you through the programmes that we offer here and the two specialist pathways within these programmes that we offer in the School of Nursing here in DCU. And then there'll be a couple of minutes if anybody has any questions afterwards. I'd be happy to answer them. Of course, if you don't want to put it in the chat, you can always contact me at my email address here on the first slide. Okay, so let me just go to the next one. Just a very brief overview of the programme. The Grad Dip and the MSc in Specialist Nursing are both Level 9 National Qualification Framework programmes. They're part-time and they're NMBI accredited programmes. Graduate Diploma in Specialist Nursing is over 1 year part-time, and that's 60 European credit transfers. And the MSc is 90 credits, and that's over 2 academic years part-time. So these programs were developed with service need in mind and the professional development of nursing in mind. So it was very much in response to the population and service needs nationally. So these programs have been in place, the MSc, for several years, and our Grad Dip offering, our entry pathway, is due to begin in this September in 2025. So really it's shaped by Sláinte Care and is shaping the future HSE and national service plans. And the whole idea is to develop nurses for a workforce that will effectively provide current and future healthcare and societal needs. And ultimately, it's to meet the professional developments needs of you nurses and to embed your learning and research within your own professional practice. So, when we look at the structure of these programs, you will either enter on the chronic disease management pathway or you will choose the women's health pathway again. These were very much developed in response to the service needs of an aging population for chronic disease management and for the lack of dedicated healthcare for women that was identified through many reviews. So, when you enter onto the pathway, your specialist pathway, let me talk you through the modules that you're going to undertake in the MSc Grad Dip programme. So if you're doing the MSc, this is over 2 years, you will do 2 dedicated modules for your pathway. So you'll have a women's health pathway, number 1, and a women's health pathway number 2. Now, just generally to give you an overview, and you can see more details on the website, the women's health pathway 1 is very much focused on normal aging for women, looking at the normal pathophysiology and physiology for women, right through from menarche to menopause and postmenopause. Women's health module 2 is much more focused on abnormal scenarios, which includes clinical history taken and assessment, including screening for the identification and the management of issues and diseases for women. Then you will also take core modules on the program. Sorry, just going back to the specialists, if you take the chronic disease pathway, module 1 is centered around an understanding of the integrated programs for chronic disease management, the evidence, the policy, and the research methodologies associated with chronic disease management internationally and within Ireland. And in module 2, you will learn about many of the chronic conditions, how to take histories, and how to integrate effective chronic disease management within your work. The core modules include health communication, digital solutions, very much about digital health literacy, that module, again, responding to the changing landscape of electronic health records and big data. We have research and evaluation methods, and you will actually undertake this module across the 3 master's programs or grad dip programs in our school, and that's centered around the common research methods that are used in health and social care, qualitative and quantitative methods, including critical evaluation, critical appraisal of literature, and evidence synthesis. You'll also undertake nursing leadership and change management, and that's a module very much clinically focused to support you to move much more into a management and leadership role, and understanding the theoretical and the practical evidence around that. In year 2, you will do your practice development project or your research dissertation. So you'll take an area of interest and you will bring that right through to a dissertation or a significant practice development project. And that's worth 30 ECTs. And that's in year 2, only for people doing the masters. We also have some optional modules that are available to all students. You will pick one of these. So what we have on offer is a module on palliative and end-of-life care, and you'll learn how to integrate a palliative care approach within your practice, the evidence and the policy informing that care. You can also choose person-centered dementia care, similar to palliative care, looking at evidence-based models and clinical programs for dementia to integrate it into your care. We also have a module called Advanced Adult Physical Assessment and Intervention. So you'll learn specialist skills and history taken and clinical examination in that module. And it's really useful if you decided you wanted to go on to be an A&P candidate, you would get some credit for having taken that module. And then we also have an offering this year called Safeguarding Vulnerable Adults. Again, very much in response to what's happening currently clinically around safeguarding vulnerable adults. So that's the MSc. You do 60 credits in year 1 and 30 credits in year 2. And just to show the difference, the grad dip here, as you can see, you're not doing a year 2. So it's 60 credits over 1 year part-time. Okay, so because this is an NMBI accredited program, of these programs are NMBI accredited, they follow the NMBI post-registration specialist nursing and midwifery education programs and standards and requirements document. So as such, there is a requirement to demonstrate the appropriate clinical competencies at the CNS, the specialist nursing level. So while you are undertaking your core specialist modules, within that, it's expected that you will be attaining clinical competency where you work as well to a specialist level. And that will be assessed in year 1. So that's relevant for anybody undertaking an MSc or grad dip in either pathway. So let me talk to you a little bit about our delivery here in DCU and why this might be a good fit for you. Well, first of all, these programs were very much developed with clinicians in mind, to be flexible, to be online, and to suit the learning and the clinical needs of people who come on the course. So this is very much a blended learning strategy. You will only be coming onto DCU campus 3 to 4 days per semester. So the vast majority of your learning will take place online, and that includes lectures, seminars, group work, tutorials, and other activities will feature as part of the modules. Every week you will have at least 4 hours live online lectures, and that happens on Fridays for the next academic year. And you also have some pre-recorded content accessible via our online learning platform, which is Loop, and you'll be expected to engage in that content at a time that suits you. Assessment design across our program here in the Masters in Specialist Nursing, either pathway, the assessment design is very much continuous assessment, group work, and assessment based in those scenarios. So there are no written exams in our programs. Really important to consider the entry requirements. So just to let people know, and these are all available on the website, you must have a primary degree at level 8. Now, for many nurses who may have qualified more than 15 years ago, you may not be a primary level degree 8, okay, because you may have been an old entrant into nursing if you were within the Republic of Ireland. But alternatively, you can absolutely apply for a recognition of prior learning in that instance. So that's a process that commences when you apply. So just because you don't have a BSc in nursing, that doesn't necessarily mean that you can't apply. You can go through the RPL process. The most important component here is that you are a registered nurse on one of the following registers. That's general, psychiatric, intellectual disability, or children's nursing. At this point in time, midwives, solely registered midwives, are not eligible to apply for these master's programs because they are NMBI accredited for nurses, not midwives. It's not a problem if you're dual qualified, but you can't be only a midwife to apply. So you have to have at least 12 months full-time equivalent experience or 24 months part-time equivalent. And you must also be employed in clinical practice for at least a minimum of 19.5 hours per week or half-time equivalent. Now, we say you must be currently employed in the specialist area setting and provide written evidence from your line manager that you'll be supported in completing your minimum hours of required practice, including your clinical practicum. So that essentially means that if you're interested in a women's health program, you must be working with women clinically, okay, for at least 19.5 hours per week. That doesn't necessarily mean you have to be working solely with women, but you have to have the opportunity to practice the skills that you're learning in the theoretical modules. Similarly, for chronic disease management, once you're in contact with people who have chronic diseases in wherever you work, you can absolutely apply. The expectation is that people are gaining this competency within their normal work environment, but there may be situations where, for example, you may want to get more information around menopause. So you may actually go to a menopause clinic for a day or two outside of your normal service hours. So that's why we say it's very important that you have written agreement and that you've discussed this with your line manager about, what do you want to achieve from the course? What does the service want to achieve? And that's aligned and supported. All applications are made through the online postgraduate applications portal as well. So if you're interested, what are the next steps? First of all, think about funding options, and explore these with your line manager. And there's different options that are available for this academic year and potentially for the next academic year as well. Visit our course pages for more information and read some of the student testimonies that are up from people who've taken the course in the past. And if you can't think of anything now, but something comes to you later, I'm always available. Please contact me by email or drop me an email with your phone number and we can have a chat over the phone if you think this may be something that you're interested in, but you'd like further information. Okay, so that's about 13 minutes and I will stop screen sharing and I will take any questions if people have them.
Thanks very much for that, Mary. It was very interesting to learn more about our specialist nursing programs. And folks, if you do have any questions, please type them into the chat and we'll just give it a couple of minutes just before we move on to our next presentation, which will be the MSc in Child and Family Health and Wellbeing by Carol Barron. But we'll just give you a minute. If you have any questions, please throw them into the chat there. So again, if anyone has any questions, please just type them into the chat. So we do have one just for you now, Mary. What is the class breakdown numbers wise?
Okay, well we have numbers of around between 12 and 15 in year one. Some of our modules, or one of our modules in particular this year, is going to be shared between first and second year. So there could be about 20 people in that class. And one of our core modules in the first year is shared across the two other pathways, the two other masters and graduate diplomas that you're going to hear about from David and from Carol after me. So that really provides a really good, rich and mix of experiences and different specialisms in the one class in the one classroom, and it's good for the learning environment. So that's the research and evaluation methods module. And when it comes to the module and the pathway specific modules, both of those modules, the numbers are very small. So, it's great. There's loads of the ratio between instructor or teacher and learner is really small. So it allows for a really, really good engagement and mix and for a really rich learning environment.
Great. Thanks for that, Mary. Just a gentle reminder, guys, if anyone does have any more questions, you can just type them into the chat or you can reach out to us afterwards. And we're just not in a position to let any of the participants just on screen. It's just due to the settings with the meeting. So if you do have questions, please do just type them into the chat and we'll be able to read them out for our panelists here this evening. So if there's no further questions then, that can be typed into the chat. Again, please just follow up with us afterwards. You're more than welcome to do that. And obviously we will be sending out a recording of this webinar this evening once it's completed, to everyone who's registered as well. So I don't think there's any more typed up questions for now. So thank you very much, obviously, for presenting on that, Mary. It's been lovely to learn more about the programme. And
Thank you very much.
Thanks very much, Mary. And we're going to welcome now Carol Barron of the MSc in Child and Family Health and Wellbeing to tell us a little bit more about this exciting programme. So Carol, I'll hand it over to yourself.
Okay. Can you see those slides?
We can do, Carol, yeah.
Okay. Okay, so you're very welcome this evening. My name is Carol Barron, and I'm the Programme Chair for the Graduate Diploma in Child and Family Health and Wellbeing and the Masters in Child and Family Health and Wellbeing. The reason, again, that this programme was developed several years ago was because there's a huge move to understand from a policy perspective, the government perspective, health perspective, education, much more about children and their families and their interactions within society. So it's meeting a societal need, if you like. It looks at contemporary evidence and issues in promoting child, the young person and family health and well-being. It does have a well-being focus, and we look to address current and future, child health and societal challenges. So if you look at bullying, social media, all of that's in there, mental health. And there's a huge move in Ireland again to look at interdisciplinary skills. The day where we were in a silo where you were just a teacher or just a nurse, they're kind of gone or going. So it's very much interdisciplinary across many disciplines and fields. Okay, so that's why this program might be of interest to you. And anybody who wants to work with children and or families or youth, there aren't a lot of masters in child and family in Ireland, and this is one of them. Okay. The types of people who would benefit from this program and who we get, it's not like Mary's program that it's just nursing, though we do have healthcare workers on it, particularly public health nurses, but we also get teachers, social workers, early years workers. The lady who wrote the child protection policy for WhatsApp was on it last year, just finished up. We have students from NGOs on it, so you get a very different perspective because it's very much multidisciplinary and it's developed that way specifically. Similar to Mary's program, the graduate diploma runs over one academic year and the master's is over 2 academic years, same credit, 60 in year 1 and an extra 30 credits you add on to that for the master's in year 2, giving you your 90. The course structure, this is what most people wanted to know about, so I haven't killed you with slides, honestly, I'm very short. It's a blended program, so that's a mix of face-to-face teaching on the DCU campus and online classes. On the first day of your orientation, we literally hand you the timetable for the year because I appreciate people are working and they need to know the dates that their assignments are due in, the days they're supposed to be in DCU, the days the weeks that they're supposed to have online classes. So we have all that available well in advance. There are 3 days, the same as the other two master's programs on campus at the beginning and the middle of semester 1 and 2. That tends to be, never mind January and March. I don't know why I've got that down there. It's in September and towards the end of October. In year 2, there's the dissertation only, and you have individual supervision with allocated supervisors who are given out in year 1. That's for those people who want to go on and do the masters, and online classes. In all of the programs, and particularly the child, the campus days tend to be the beginning of semester, and we tend to do them on a Thursday, Friday, and Saturday. And we run them on a Saturday because students said they wanted it on a Saturday because they didn't want to use up all their annual leave. So that's why it's run that way. It's at student request. So what are you going to study? Well, in year 1, for the graduate diploma, you undertake 6 modules. As Mary said, I won't go into it too much. The research and evaluation methods is shared across all programs. So that's a large module in relation to numbers. In semester 1, you look at child and family focused care and well-being. The other thing we have found is that if it's been quite a few years since you've studied, people are well able for master's level study. It's just a confidence issue, though, that they have. So we do focus a lot on writing skills and, familiarizing yourself again with academic writing, because you might be very well used to report writing or, writing for parents, things like that. It's just a different form of writing. So we do focus on that for you just to increase your confidence level. No masters in child or family would be complete without a module on children's rights and participation. And we're very lucky in Dublin because I run that module, but we get in the Ombudsman for Children's office. I can bring in colleagues from the Department of Children for you because Ireland is actually very good for children's rights and participation. We can get Harry Shire, who's written models of child participation. So that's covered there. Contemporary issue, next is global child health and health inequalities. Although there's a lot of similarity in the child health inequalities internationally, there are unique differences as well. And we've got great European and then international data sets to look at what are the current issues, what are the upcoming issues, and how they're going to impact on your practice, be it in education, be it in health, wherever it may be it in the guards. Okay. Contemporary issues in child and adolescent mental health. Again, this is child, so it covers from 0 to 18. It's not early years or, preschool or anything like that. So again, we would get specialists in for you from Young Ballymun in Dublin, looking at mental health issues in infancy, right up to 18. And that's a very popular module. And a lot of people, no matter where they're working with children, said they don't feel they currently have the skills to deal with the mental health needs of children. They know they have them, but they don't feel they have the personal, capability currently to do it. So we make that a standalone module. So that module numbers would be larger because we get a lot of interest in it. I've said about the research and evaluation methods, and then the community-based care. Community-based care is for family health and well-being, whether it's a social work background, education background, health. It's what services are out in the community, the interdisciplinary nature between and all of these disciplines. And again, it's the societal, it's working with the JLOs, the juvenile liaison officer from the schools, from health needs. And it's trying to get everybody aware of everybody else's role and what services are there and where the future is going for community-based care. At the end of year 1, you'd have the graduate diploma. So you'd have your 60 credits. So you have to pass all of those modules to get them. The evening hours tend to be on a Tuesday and Thursday, 6 to 8. So you come on with your cup of tea. Most of our sessions tend to be live. They're not pre-recorded. They're live. And some of our speakers will come in during the days for you. Some of them will do the Zooms. And then if you want to go on and do the masters in year 2, it's the research dissertation only. And again, as I said, I allocate out supervisors in year 1 so they can help you with your ethics application, what's feasible and what's realistic to research within your area. And again, it's to think about, what's going to help you in your profession, as opposed to just what your employer wants you to do. It's trying to get that balance between them. So why would you bother doing the MSc in Child and Family? Well, again, similar, there's no exams. A bit like most masters, they don't have exams these days. There's a mix of the online and face to face, and so the weeks that you're in for face to face, you don't have online. You'd always have week 7 of a semester off for reading week, so you're not on every week. It's not that bad. You do get up to date evidence-based knowledge given from my colleagues in DCU and myself, as well as experts that we bring in. There's a really good mix of teaching methodologies, lectures, seminars, workshops. We do have a very wide variety. You get a mix of small and larger groups. So you might, for this, say the children's rights module, you might have 6 to 8. For the mental health, the child and adolescent mental health module, you could have 10, 12, 14. For the research methods, it could be up to 30 when they're all together. So you do get a nice mix of small group and large group, and you get a nice mix of different disciplines, different backgrounds, and that's half of the learning in a lot of these programs. Networking, you make really good friends within your own field and beyond, which is extremely valuable. I was looking up what our students had done since they've completed the masters, and there isn't like just one reason why they're selecting the masters, but it tends to be either promotion within your current profession. People want to move to community employment. They want to move from industry, healthcare, education into a more community-based setting, or they want to change career field totally and need the masters in child to do that. So there isn't one only reason for people using this program. It tends to be multiple, depending on their own personal backgrounds. Okay, so that's the end of that, and hopefully I was even quicker than Mary. And if anybody has any questions, I'm happy to take them now. Or again, like Mary, my email's up there, carol.barron@dcu.ie. Just email me and we can do a Zoom or an email or a call.
Thank you very much for that, Carol. And we actually do have some questions. So, first one being, could we start the diploma route and change our mind to progress to the master's halfway through? And as a follow-up, how achievable is it to study the master's program?
Okay, it's yes, you can do the graduate diploma and then decide halfway through first year, I want to go on and do the masters. I want to be very realistic with people. You're working full time in whatever your field is, and it is a lot of commitment to do 6 modules in a year. It is commitment. It's Tuesday nights, Thursday nights, the couple of days in DCU, the assignments. So it's not a walkover. None of them are. But, you don't get nothing for nothing, but you do get huge amount of support in DCU. I will say that. So yes, it's doable. All our students, the success rate is very high. And I think once they get through first year, they think, oh, second year be a breeze because you only have your dissertation thereafter. Okay. And again, an awful lot of the modules that you take in first year actually help you with the dissertation. So your research methods is an obvious one. Or maybe you're looking at care in the community and you're interested in special education or children with special needs in early year settings, whatever it might be. And you would get a special supervisor in that to go on and do your research in that for year 2. Okay. So the content that you get within the modules actually does help you for the dissertation as well as just give you the credits. Does that answer the question to the satisfactorily?
I believe so. Folks, if we do have any other questions, please do let us know. Yeah, the attendee has just said thanks very much.
Oh, good. Okay.
So, guys, if anyone else has any other questions, please let us know before we move on to our next talk. More than happy to take them. That's what we're here for. As I said, as Carol has mentioned, you can obviously follow up with her separately afterwards if you wish. And over the next few days, following the conclusion of this obviously webinar, the recording will be sent to you all as soon as. So let me just see. So just with regards to the we just have a question here on chronic disease management, folks, that has been covered, but don't worry, the webinar recording will be sent to you, Anne, and as a result, you'll be able to get the full description there, and you will have the contact details for Mary and Evan, who gave the presentation too. So don't worry, that information will be sent on to you afterwards. Just double checking. Yeah, so we have no other questions, I think, for yourself. Carol, thank you so much for presenting for us on your program, the
Very
MSc
welcome.
Child and Family Health and Wellbeing. So, folks, we're going to move on then, and I'm going to introduce my next guest. Thanks again to Carol. David Lockery, the program chair of the MSc in Health and Social Inclusion. David, you're very welcome, and I'll leave you to it to do what you do best. Thanks very much, folks.
Thank you, Martin. So, my name is David Lockery. I'm an assistant professor in community health here in DCU. So, I'm just going to share my slides now. Yes. Sorry, just a sec. Sorry, I'm just having an issue with PowerPoint here. So, this is just to give an overview of the Master's and Graduate Diploma in Health and Social Inclusion. So, I'm just taking over from the previous program chair. I just took over this month. But just to give you a brief overview of the program, it's the same structure as the other Master's program. So we have the Master's and we have the Graduate Diploma. The Master's is 2 years. The Graduate Diploma is 1 year. It's a level 9 program. It's part-time. We had our first cohort in 2022. So it's a very recent program, and it was developed. It's the first of its kind. It was developed to address how social exclusion or inclusion or social determinants play a role in health disparities in the community, especially in recent times in Ireland. The demographics of the community have changed, and there's great awareness of how exclusion, especially for marginalised parts of the community, such as those with disabilities, can play a role in health disparities. So it's very much an interdisciplinary program. The graduate diploma is 60 credits 1 year, and the master's is 90 credits for 2 years. So as an interdisciplinary program, the students undertaking this program are very often are quite diverse in their skill sets, in their interests, and come from various different sectors across the health sphere, such as policies, practitioners, clinicians, doctors, nurses, physiotherapists, social workers, and so on. So the program is really geared towards those who are practicing in health related field or who are interested in pursuing a career in this field. It's very broad, and it's caters to a very wide range of interests, and allows people to, I think, to understand the context or the context in which health develops within the community. So our students are employed by a very wide range of services, such as the HSE and public health, mental health services within local government, such as a county council, sports partnerships, and so on, and by various NGOs that address the needs of marginalised community groups, such as homelessness services, drug addiction services, residential care settings, and our students are employed nationwide. So students who graduate from our program will be capable of identifying and analysing the major underlying causes of health inequities and social exclusion. It's about understanding exactly how the social sphere contributes to poor health outcomes, particularly for those who are marginalised in our society. How to effectively design or implement and evaluate interventions to improve community health engagement and social well-being, and how to develop advanced skills in health and social inclusion in terms of leadership, in terms of research, and in terms of practice development. So the program delivery is the same as for the other masters. It's very similar. It's there's a blended, flexible learning format. Our masters students are very typically working full time, and our learning format includes face to face, in person, and also online learning. So typically, it's 6 on campus days for each semester, which lasts about 12 weeks for the core modules, and then more days depending on the optional module choice. So online teaching is typically conducted in 2-hour blocks and 2 evenings, so Tuesdays and Thursdays typically, and additional time is then spent on independent learning, reading, writing, and on group work. So our course instructors will outline the reasons for you to do and encourage your independent learning. The core modules, there's 5 of them, so they are very much related to different aspects of health equity, to understanding how health promotion can work in context organizations in terms of practicing and perspectives, in terms of health and social engagement across the lifespan, leadership and innovation for health and social inclusion, and developing research and evaluation methods. So these core modules are very much in line with the other master's program, but tailored within this particular context. And then there's the optional model, choose one. So this is either trauma-informed professional practice for our clinical practitioners, independent study module for those who are interested in developing study skills, and safeguarding adults at risk. Those core modules and that optional modules are for the graduate diploma and for master's students, and master's students can then progress to complete 130 credit module in year 2. So this is either the research dissertation, in which you can pursue a particular interest that you have, that you want to explore more in terms of research, or the practice development project, similar to the other 2 other programs. So just to give an idea of what our assessments are like, there's no exams in this in the graduate diploma or the master's. The assessments are continuous. So achieving health equity perspectives and practices, it could be, for example, a critical case study. For health promotion, it's a class presentation and a written assignment. And leadership and innovation, it's a group presentation and an essay. For health and social engagement across lifespan, it's a case study presentation and a written assignment. And for research and evaluation methods, it's the developing research proposal, it's the practice development project proposal. So these are assessments that are very much geared towards helping you to learn the content, but also to develop the skills that you need to move forward in your career. So the entry requirements for this program, our applicants would typically hold a primary degree in a related discipline such as nursing or medicine or physiotherapy at a level 8 with a grade of 2.1 or above. Alternatively, if applicants don't have a degree, they can try and demonstrate equivalency via a recognition of prior learning or experience process. So this process begins when an online application has been received. All applications for this program are made through our online postgraduate application portal available on the DCU website for this program. So that's the website there, and you can see in the red box, if you click on that button, that will begin the application process. Applications for the EU applicants beginning in September closes on the 30th of August, and non-EU applicants, I believe, closes in the 1st of July. So this is testimonials from previous alumni. Alumni very typically find that the program has been very helpful in understanding the relational nature of social exclusion for people from marginalized communities, and find that it's a very practical program that helps equip them with the knowledge and skills required to tackle these issues. So a 2-year master's can seem quite daunting to begin with, but our previous alumni have found it very informative and very helpful. So thank you. So if you have any questions, please send them on, or if you have any further questions that you think of later, please feel free to just email me and I will get back to you as soon as possible.
Thank you very much, David. And I think we So, would you recommend any readings or courses to do in order to prepare you before starting the program?
Well, if you're interested in understanding the program better, there's more information on the website. If you would like to email me, I can get in contact with, I can give you the list of the modules, and I'm sure that the course coordinators for those particular modules have a reading list. So if you want to contact me, I can ask the course coordinators to forward those to you.
Great, thank you for that, David. Has anyone else any other questions, folks? We obviously want to make sure that we answer all your questions before we finish up this evening, as David is our last speaker. So if you have any questions, please throw them into the chat. Obviously, just a quick reminder, obviously, that to reiterate, this recording will be sent to everyone who has registered in the next couple of days, coming weeks. So you will all get it. So not to worry. If you've missed anything or you've joined us a little bit later, it will be sent to you. And in the meantime, you can obviously visit the DCU website and reach out to us if you have any further questions in the gap between this webinar and the recording being sent to you. But obviously, we are more than happy to stay on for just the next couple of minutes if anyone does have any other questions. Yeah, and we do have one here. Is this suitable for staff working in the ID services, David?
Absolutely, yeah. So this program is it's quite broad because obviously, particularly for people who are working with those who are vulnerable. So obviously, those who are vulnerable tend to be more marginalised in our society, particularly the people with disabilities, and they're obviously much more vulnerable to health disparities. So this program is obviously ideal for people working in that area. It's broad in its course modules, and then if you're interested in pursuing the masters, you have the option of doing a dissertation in particular area of research, which you can focus on your own particular area.
Brilliant. And then I think so that's grand. Thank you for the questions, guys. And please keep them coming. If anyone has any further questions, we obviously are happy to hang on and ask away, and we'll hopefully answer away. Well, David will anyway. I don't claim to know too much about this area of expertise. Okay. Okay, folks. Well, if we don't have any other questions, then we can obviously let everyone get back to their evenings. Thank you so much for attending this postgraduate webinar from our School of Nursing here at Dublin City University. I've been Martin Kelly with the postgraduate student recruitment team, and I want to give a massive thank you again to David Lockery, Programme Chair of the MSc in Health and Social Inclusion, for his time this evening, along with Dr. Carol Barron, Programme Chair of the MSc in Child and Family Health and Wellbeing, and of course the MSc in Specialist Nursing Programme Chair, Dr. Mary Nevin. Thank you all very much for presenting on your programmes and answering all the questions. And thank you to everyone who has attended and asked questions this evening. And we will obviously send the recording of this webinar to you all. But in the meantime, thank you all very much for attending, and take care and have a lovely evening. And we'll catch up with you again very soon. Thanks very much, everybody.